Hi, Eileen Veilleux, the fam here. Welcome to another installment in our mini mental health series. And in today's installment, we will be learning about paranoid personality disorder. Before we begin, let me just remind you to please watch the full video because in the video there will be three keywords. When I get to the keyword, I will say keyword, then what that keyword is. At the end of the video, in the comment section, along with the genuine comment about the video, put in what the three keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So, what is paranoid personality disorder? Well, personality disorder, otherwise known as PPD, is one of a group of conditions called keyword cluster A personality disorders, which involved odd or eccentric ways of thinking. People with PPD also suffer from paranoia, an unrelenting mistrust and suspicion of others, even when there is no reason to be suspicious. This disorder usually begins by early adulthood and appears to be more common in men than in women. So, what are the symptoms of PPD or paranoid personality disorder? Well, people with PPD are always on guard, believing that others are constantly trying to demean them, harm them, or threaten them in some way. These generally unfounded beliefs, as well as their habits of blame and distrust, might interfere with their ability to form close relationships with people because of their disorder. They doubt the commitment, loyalty, or trustworthiness of others, believing others are using or deceiving them. They are reluctant to confide in others or reveal personal information due to a fear that the information will be used against them. They are unforgiving and hold grudges. They are hypersensitive and take criticism very poorly. They read hidden meanings in the innocent remarks or casual looks of others. They perceive attacks on their character that are not apparent to others. They generally react with anger and are quick to retaliate. They have recurrent suspicions without reason that their spouses or lovers are being unfaithful. And they are generally cold and distant in their relationships with others and might become controlling and jealous. They cannot see their role in problems or conflicts and believe they are always right. They have difficulty relaxing and are hostile, stubborn, and argumentative. So, what causes this paranoid personality disorder? Well, the exact cause of paranoid personality disorder, or PPD, is not known yet, but it likely involves a combination of biological and, keyword, psychological factors. The fact that PPD is more common in people who have close relatives with schizophrenia suggests a genetic link between the two disorders. Early childhood experiences, indulging physical and emotional trauma, are also suspected to play a role in the development of PPD. So, how is this disorder treated and diagnosed? Well, if physical symptoms are present, the doctor will begin an evaluation by performing a complete medical and physical history and, if indicated, a physical exam. Although there are no laboratory tests to specifically diagnose personality disorders, the doctor might use various diagnostic tests to rule out physical illness as the cause of the symptoms. If the doctor finds no physical reason for the symptoms, then he or she might refer the person to a psychiatrist or a psychologist. healthcare professionals who are specially trained to diagnose and treat mental illnesses. Psychiatrists and psychologists use specially designed interview and assessment tools to evaluate a person for a personality disorder. Now, to treat people with PPD, the thing is the people that have PPD do not normally seek treatment themselves because they don't see themselves as having a problem. So when treatment is sought, psychotherapy, which is a form of counseling, is the treatment of choice for PPD. Treatment likely will focus on increasing genuine coping skills, as well as improving social interaction, communication, and self-esteem. Because trust is an important factor of psychotherapy, treatment is challenging since people with PPD have such distrust of others. As a result, many people with PPD do not follow their treatment plan. Medication generally is not a major focus of treatment for PPD. However, medications such as anti-anxiety, antidepressant, or antipsychotic drugs might be prescribed if the person's symptoms are extreme, or if he or she also suffers from an associated psychological problem such as anxiety or depression. So, are there any complications associated with PPD? Well, the thinking and behaviors associated with PPD can interfere with a person's ability to maintain relationships, as well as their ability to function socially and in work situations. In many cases, people with PPD become involved in legal battles, suing people or companies they believe are out to get them. So then what is the outlook for these people that have PPD? Well, the outlook for people with PPD varies. It is a keyword chronic disorder, which means it tends to last throughout a person's life. Although some people can function fairly well with PPD and are able to marry and hold jobs, others are completely disabled by the disorder. Because people with PPD tend to resist treatment, the outcome is often poor. So, knowing all of this, is there any way that PPD can be prevented? Well, although prevention of PPD might not be possible, treatment can sometimes allow a person who is prone to this condition to learn more productive ways of dealing with situations. And that's about the only way you can do it is if you think you may have this before you diagnose, which what they'll do is if they find out someone in your family has schizophrenia, they might teach you ahead of time in case you have this different ways to cope and handle problems so it's not as bad for you. But as you can see from here, PPD is a psychiatric diagnosis characterized by paranoia and pervasive long-standing suspicions and generalized mistrust of others. The causes of it could be genetic paranoia trait, schizophrenia, projection of negative internal feelings, and parental modeling, which is psychological therapy. So that's what PPD is. As with any mental or physical disorder, especially mental, this is on the inside of a person. So if we were to see somebody, why should we dare judge them by what we see if we don't know what's truly going on? Because in a way, when we become distrusting, we're almost as bad as somebody with paranoid personality disorder. Because we're judging by what we see. So, therefore, we're not trusting. We're skittish on a lot of things. And that's why it's so important to judge with your heart and not your eyes. Just looking at this picture, you see a man that's frightened. But do you know why? Without reading any of this, if you just seen somebody that looked like, would you know why that person was afraid? No, of course not. You can't tell just by the outside. You don't know if they have any mental illness. You don't know if they have a physical. Well, some physical illnesses you can see, but there's others you can't. But most of all, you have to remember mental illnesses are on the inside. They're invisible to the eye. The eye can't see them. So therefore, if you was to judge somebody, you could be judging them wrongly because you're not seeing the inside. Now, if you see the inside, then maybe you could judge properly. And just remember, nobody on this earth is perfect. We all have our flaws. Whether it's we have physical and mental flaws. No one on this earth is perfect in any shape, form, or matter. The only thing, matter of fact, that we're perfect in is being imperfect. That's it. So therefore, we have no right to judge one another. And it's much better not just for the other person, but mainly for us, if we encourage people, uplift, and inspire them, because when we are positive and we have positive thoughts and feelings inside of us, we're more healthy because when we do that, when we make somebody else happy, or by encouraging them, inspiring them, uplifting them, what happens when we do that is we release endorphins inside of our body. Now, the endorphins are like natural healing agents for your body. They keep you healthy. Now, if we was to do the other way, and we have negative thoughts and feelings for somebody, and we act out on that negativity, then we release negative energy inside of us, and we get sicker more. Which would you rather have? I would rather have the endorphins that help heal my body instead of things that bring my body down. I'd rather be much healthier than much sicker. So you see, not judging somebody and being on a positive note with people and things is more beneficial to you than it is to the other person. And that's what my series are all about, is teaching people how to see from the heart, and not with the eyes. See, I've gone through life being legally blind I've had bad eyesight since I was born. Started wearing glasses when I was 2. Yes, I've been bullied, I've been picked on growing up. Yes, as a child it hurts. I didn't know how to handle it, but as an adult I know how to handle it. It don't bother me. But I've been on both sides of the fence. I've seen people that's worse than me. But I've learned that I'd rather help people instead of hurt them. And I want to do that through this series. Education is the first key in anything. That's, the saying ignorance is bliss. That's not true. Education is power. The more we're educated on something, the more we'll be able to understand and be able to handle it better. Going up to somebody and you don't know what's going on with them, you don't know. You can't react accordingly. Going to somebody that you're educated on these different things, that's the first step in knowledge. You you now know, okay, they may have this mental illness. They may have something different. But you have a stepping